Coronavirus resurges just as many feared it would. Michigan sees its highest daily case counts yet. The governor says we are overwhelmed as hospitals and schools try to adjust on the fly. Today is Sunday, November 15th, 2020, and this is Flashpoint. Hi, welcome to Flashpoint on this 15th day of November, which means Thanksgiving is now less than 2 weeks away. Just about every American family has its Thanksgiving rituals, but few cities are as laden with Thanksgiving tradition as Detroit. America's Thanksgiving parade, the annual game for the Lions, they're piled on top of the full table and family get-togethers. But as Governor Whitmer noted Thursday, Thanksgiving will look different this year because it has to. The parade will be a strictly televised event. The Lions will take on the Houston Texans at a nearly empty Ford Field. And health and government leaders are urging us all to set smaller tables this year. Connect with family via FaceTime and Zoom rather than in person, lest we allow yet another gathering holiday become a super spreader moment. And looking at the daily totals, the testing positivity rate, the surging occupancy rates at hospitals, we have very little margin for the numbers to get even worse, and yet almost everyone fears they will. We're going to set aside the political world this morning and focus on the virus that is now killing many more than 1,000 people a day right now in the U.S. Yes, we were given a dose of hope last week for the arrival of a vaccine, but it will not come in time for too many. And as we fight COVID fatigue, public health experts are trying to slap us awake and get us back to all of those extra measures that we were taking in the spring. It means another boomerang for schools. Parents who in some cases just got a few days of in-person learning are suddenly back home. And the state's biggest district, the DPSCD, has parents scrambling to make arrangements to go back to remote learning starting tomorrow. We're going to talk about the school dilemma just ahead. But let's begin with a rather extraordinary Zoom news conference that happened on Thursday when we saw the leaders of most of our area health systems all together urging us to steer around the disaster taking shape on the horizon. We'll start there today on Flashpoint. Well, it was a most unusual scene this past Wednesday. We saw a Zoom screen full of faces and voices that are usually competing with each other, but this time all coming together to try and get Michiganders on the same page when it comes to fighting coronavirus. Very good to have with me two of those faces and voices. Brian Peters is with us, the CEO of the Michigan Hospital Association, which represents all the community hospitals in Michigan, and Wright Lassiter on the right, Wright Lassiter III, the president and CEO of the Henry Ford Health System. Brian, let me start with you. If it doesn't speak for itself, tell me about the moment at which we've arrived when it's necessary for all of these hospital CEOs and administrators to come together and try to get us on the same page.
Well, thank you so much for having us. And you're exactly correct. The end goal here is to get everyone on the same page. And certainly that starts with our hospitals. As you said, perhaps competitors in the marketplace, but when you're facing what is truly a public health crisis, and that's what we are in today. We really do need to come together. That's exactly what's happening. And our member hospitals and health systems yesterday wanted to speak with a united voice and make very clear to all Michiganders that this is a pandemic to be taken very seriously. It's a pandemic that is affecting not only Southeast Michigan, but quite literally the entire state. So we are calling on all Michiganders to do their part and help us to defeat the COVID-19 pandemic.
Brian, was there a metric that we ticked over? Was there something that you saw, or has this been bubbling for a while as an idea to get everybody together to speak with one voice?
We had been very hopeful over the summer months that we had been successful in flattening the curve, and there was always in the back of our mind a concern that we would see a second wave. And in fact, that is precisely what has transpired. And as we look every single day at a number of metrics, positivity rates, a number of Michiganders who are testing positive, but in our case, looking very specifically at the number of hospitalizations, we are on pace, if the current trends continue, to surpass our all-time record high that we achieved earlier in the year in terms of inpatient hospitalizations, COVID-related, within the next several weeks. And so it is certainly time to ring the alarm bell.
Wright Lassiter, how is this different, do you suppose, from, I think everybody felt like we got over the roughest patch, which was back in the spring. Is what we're seeing right now different, or is it more like hitting the repeat button?
Devin, thanks for having me, and I'm really pleased to be here with Brian to talk about our efforts to fight the pandemic. To your question, I would say the answer is yes and no. It's the same in that we have a significant escalation of morbidity and mortality in our state. Individuals who are testing positive, individuals who are needing to be hospitalized, and individuals who are dying on a daily basis. And so, to that regard, it's very similar. What's different today is the distribution of cases. Southeast Michigan was primarily hit hard and early back in March and April and May. And so, it really was the Southeast Michigan hospitals that were bearing the significant brunt of the coronavirus hospitalization challenges. Today, you're seeing it spread across the state. You're seeing escalation of cases and positivity rates in Grand Rapids, in Lansing, in Kalamazoo, in the Upper Peninsula. And so that's different. And for us, I would tell you that it's quite different. Certainly the volume at this moment is not what it was back at the height of the pandemic in the spring. During our highest period of time, which occurred in April of earlier this year, we had just under 1,000 patients across all of our hospitals. Today, that number is in the low 300s, and so we certainly don't have the volume that we had back then. But what's different is that our leading hospital with inpatient cases is Macomb, Henry Ford Macomb. Last time, clearly the case volume was the highest and the hospitalization was the highest in the city of Detroit.
Right.
And so Henry Ford Hospital bore the brunt, even though every facility of ours had cases. But it's interesting today that it is Macomb with well over 100 inpatient cases, Henry Ford Hospital with a bit over 60 cases. And then we see almost the same number at our Henry Ford Allegiance Hospital in Jackson, along with a similar volume at West Bloomfield and downriver. And so we're seeing a spread across the entirety of our system, but with a concentration in places that we didn't see last time. And I guess I'd say lastly, the other difference is we know that throughout the summer, what was a significant benefit to the hospital systems were that as the cases were rising, they were rising with younger individuals who were not having the same level of morbidity, of symptoms, as was the case early on with folks in their 60s and 70s and 80s contracting the disease. We're now starting to see that shift change again away from the under 30 population back to the 30 to 39, 40 to 49, 50 and above. And those are the individuals who oftentimes have underlying conditions and will have a greater need for hospitalization and work from the healthcare industry.
In fact, right, the lowering mortality rate, which hard to say that's not good news. It has been a little bit less deadly over these last couple of months, but that's also kind of hurt your cause a little bit, right? Hasn't it maybe created a little bit of a false sense that we've got this under control, that it's not as bad as we thought it was?
Yeah, I absolutely believe that we're dealing with a bit of early optimism that was premature because we all want to get back to some sense of normal. And so certainly as the cases were going down in the summer, it was a combination of people being outside and frankly being able to be in places where they could social distance, even if they weren't wearing masks, even though we know that many were. So I do think it's a bit of premature optimism. I also believe it's pandemic fatigue. We've been going through this for a long time, and as human beings, we oftentimes we want a bit of instantaneous gratification, right? We want to be rewarded for our efforts, and so I think that's a part of it. And then I would also say that because there were parts of the state that you didn't see cases previously, I think a lot of folks put their guards down and said, "Oh yeah, this isn't really happening in my community," and so they felt less inclined to do what's necessary. And I would honestly just say, Devin, that's what we see across the country. When you look at the states in America today that have the highest the highest rates of case escalation, it's many of our states that have some of the lower populations. It's places like North and South Dakota, where you don't have large urban centers. And so it's clear that the pandemic not only strikes in urban settings, but it strikes in rural settings and suburban settings and settings where there's humanity.
And a lot of those places we're seeing positivity test rates that are into the 40 and 50%, which is hard to even imagine. Brian, let me get back to you. We saw back in the spring Governor Whitmer and other local health officials making plans to create sort of satellite hospitals. We knew there was going to be the situation at TCF and at the suburban collection. And on closer inspection, they didn't get used very much because we find that they're really not set up to be hospitals. You can't be, 100 yards from a bathroom if you're trying to set up a hospital. What happens now as we've learned more if our hospitals get pushed to the breaking point? What do we do this time?
Well, when you look at healthcare, nothing's easy. But in relative terms, it is easier to add beds, add capacity to a hospital or a facility. The thing that is much more difficult, and that applies to a traditional hospital or to a field hospital, as you alluded to, is the staffing element.
Yeah.
And so unless those alternate care facilities or field hospitals come with new staff complements, they aren't truly going to help us much. I think we are wide open to any and all innovative solutions, including alternate care facilities, as you described, if in fact we reach our capacity point within the traditional hospital structure. But I think, as Wright would tell you, it's really that issue of having enough frontline caregivers, particularly when many of those frontline caregivers in our hospitals are also testing positive for COVID, mainly catching that because of community spread, catching that in small group settings in the community as opposed to in the hospital. But regardless, the staffing issue is really going to be the most complex and complicating.
In fact, that's what's led to this situation in North Dakota, where you've got COVID positive healthcare workers being told they can go ahead and work to take all the best precautions that they can, but such is the plight of having enough hands on deck. Right, I'd love to let you weigh in on one issue that seems to continue to linger. President Trump had made a claim of this during the campaign stretch, and I still see it on social media and in emails, and that is that COVID cases are somehow profitable for you and for doctors treating them, and that it's in your best interest to have more of them.
Yeah, I would just say that unfortunately that's not factual when you look at the totality of what we're dealing with. It is certainly true that there is a small uplift around COVID as it relates to the increased cost of providing care for a COVID patient. And so while that is certainly true, but when you think about Medicare reimbursement for providing care, generally speaking, Medicare reimbursement, which is what comes from the government, does not fully cover the cost of care for the vast majority of healthcare systems across the nation. And so it's certainly not a truism that the hospital industry or physicians as a profession have any incentive to code someone as a COVID patient to make more money. That's just not true.
Wright Lassiter, Brian Peters, thank you both so much for your time today. I know you both are fearing what might be on your plate here over these next couple of weeks. We wish you and all of your colleagues all the best. Thanks for the time.
Thank you.
You bet. We'll continue with more on Flashpoint as we move now. What do schools do as the pandemic worsens? This is Flashpoint on Local 4.